for your presence here today. I'm sure you will enjoy listening to each of our special guests here. In conclusion, I want to thank you all once again for being here. We are really very happy and feel honored to have you all amongst us. Your presence and participation is what would make the celebration of International Midwives Day a grand success. Let's make the most of the opportunity to learn, share, and update ourselves with midwives being critical in every crisis. Thank you all very much. Thank you. Thank you, Patsy.
I just welcome everybody on the YouTube. I mean, sorry for the delay. There was some technical error. I think 324 people are watching us, isn't it? I know I can hear you say yes. So I expect everybody to say yes. Can you make me spotlight, Jaivir? I don't know. It's a Monday today. I think my boys are still need to be active at the weekends. They have not come out on the weekend. Looks like that. Anyway, wish you all a very, very happy midwifery day. I'm so glad that you're all here. I think I can hear your shouts saying yes for our program. We are continuing. I know we have started the program, but you all joined us late, but you can watch us on YouTube later on. Now I welcome Dr. Saswati Das with virtual bouquet. I know whether the boy is able to do that. And Dr. Saswati Das is a renowned public health expert with a master's degree in public health from Jawaharlal Nehru University, New Delhi. And she's a medical doctor. She currently serves as a sexual and reproductive health specialist at UNFPA in India, leading the SRH thematic unit since August 21. Prior to this, she spent 11 years as Director Program and Clinical Service at Jepaigo, with 30 years of experience of working in India with reputed international health organizations that work for technical assistance to governments' reproductive health programs and with private sector health service delivery. Dr. Das has provided technical and managerial leadership in various areas, including maternal health, family planning, reproductive health, and HIV prevention. She is a recipient of Certificate of Honor in Community Medicine during her medical education. She is an international training expert certified by Jepaigo headquarters and has provided technical assistance to countries across South Asia and Africa. Additionally, she is a nominated and selected member of the prestigious Global Technical Advisory Group for High Impact Practices in Family Planning since 2019. I request now Dr. Saswati Das, Madam, to unfurl the theme of IDM 2025, Midwives Critical in Every Crisis. Over to you, Madam.
Thank you, Bharti. Can I share my slides?
Sure, ma'am. Sure, ma'am.
Okay. It shows host disabled participant screens.
Yes, ma'am. Yes, ma'am. Please. Now we can see.
Okay. No, it says disabled.
Yes, no, I have made you co-host. Please, again, just check that. I made you make. Yes, ma'am.
Okay.
Yes, ma'am. We can see the PPT.
Okay.
You can make it slideshow, please.
Is it now in the slideshow? Is it showing on the slideshow?
Yes, ma'am. Yes, ma'am.
Okay. So thanks, Bharti, for your kind introduction. Good morning, everyone. Respected dignitaries, health professionals, and esteemed colleagues and friends. It's an honor to join you today, and thanks to the Indian Nursing Council as we celebrate this day of the International Day of the Midwife under the powerful theme, Midwives Critical in Every Crisis. Midwives are pillars of strength in every health system, especially in times of crisis. So, you know that ICM, International Confederation of Midwives, each year selects the theme for the IDM to spotlight midwifery's global role. And any crisis, pandemic, natural disasters, or conflicts, it threatens maternal and newborn health. And with climate change driving more frequent and severe emergencies, these vulnerabilities are increasing. And globally, midwives are the frontline responders with their skills and compassion in these situations. For India, midwives can bridge the service gaps and ensuring that dignified maternal and newborn care are available in both normal situations and as well as in emergencies. So this is quickly to look at the maternal health landscape of India. According to the recently released report of United Nations Interagency Group, India has got remarkable achievement. India's estimated maternal mortality ratio is at 80 per 100,000 live births. Yet, some states like Bihar, MP, Chhattisgarh, Rajasthan, UP, Assam, Uttarakhand, they face disproportionately high maternal health risks, and that is the same within the state, some underserved geographies and vulnerable communities. Another remarkable progress for India is institutional deliveries. 88.6% deliveries are happening at the health facilities. But this progress is accompanied with some concerns like high cesarean section rate, though it stands nationally at 21.5%, but some states report as high as 60%, 50%, 40%. So that is a concern. And we also hear about disrespectful maternity care, especially in overcrowded facilities. So what I mean to say is that India is now in a pivotal moment. There is a remarkable progress, and to move forward, we need to address the inequities and ensuring that all women, irrespective of their location and socioeconomic status, get safe, respectful maternal and newborn care. The global evidence has confirmed that investing in midwifery gives outstanding maternal and newborn health outcomes and exceptional economic value. You can see these are some of the evidence that is shown on this slide, that midwives can deliver up to 90% of essential sexual, reproductive, maternal, newborn, adolescent health. Scaling up midwifery services could avert more than 60% of maternal newborn deaths and stillbirths. And investing in midwifery is smart economics. Investment of $1 can give return to almost $16 this thing. So this is a smart investment. And the Lancet series of midwifery has captured all evidences, and it shows that midwifery doesn't only provide positive pregnancy outcomes, it gives social benefit, and it supports dignity and confidence to women and families. So how this matters for India? The evidence is clear. India can benefit immensely from stronger midwifery services because it prevents maternal newborn deaths, it prevents stillbirths, it reduces inequities by providing access to underserved geographies and underserved communities, and it lowers the cost of operationalizing health facilities because it promotes physiological or normal births, and it reduces over medicalization. This also, midwifery supports appropriate C-section rates, and midwifery gives outstanding economic benefit. Evidence shows that scaling up of midwifery is 2 times more cost effective than physician-based expansion. Though it is not either or situation, we need both midwives. Midwives are essential, and as well as doctors and obstetricians. By averting 67% maternal death, 65% stillbirth, with full coverage by 2035, midwifery can contribute to India's aim for universal health coverage and sustainable development goals. Midwifery can also fill the shortage of health workforce in India, and it builds resilience to public health system for climate-induced emergencies by continuing essential services during these situations. Actually, according to the evidence, the collaborative partnership between midwives and obstetricians can strengthen the entire health system. We all know that after the launch of Midwifery Services Initiative in 2018, Government of India, Ministry of Health and Family Welfare has released all essential directives and guidelines like curriculum, scope of practice, financial guidelines, learning resource package, guidelines on how to establish midwifery-led care units in public health facilities, mentoring guidelines, and the training institutes have been established. The figure on the in the last column is somewhat older, as of August 2024. But National Midwifery Training Institutes, 8 are functional, 14 state midwifery training institutes are functional, and more are getting established. What I mean that midwifery is rolling out in India, but it needs scale up. And the Midwifery Services Initiative integrates into the other existing maternal health program like Suman, further improving the quality of care. And this momentum can transform maternal and newborn health outcomes if scaled up strategically. So what we need for scaling up midwifery in India are 3 key things: strategic investment, effective program implementation, and collaborative partnership across all stakeholders: government, both national and state government, nursing councils, midwifery training institutes, midwifery professional body, development partners like UN and other NGOs supporting midwifery, public and private providers, medical education institutes, and midwifery professionals. So through this collaborative partnership, we need to focus on correcting misconceptions. Midwives are not the yesteryear's traditional birth attendants or dais. They are skilled professionals, essential for quality obstetric care. We need to focus to attract and retain midwives through their recognition, career growth, and supportive work environment. We need to ensure quality education through cost-efficient training and mentoring strategies. And we need to focus on expanding midwifery-led care units to lower-level health facilities, especially in underserved areas, to ease burden on a higher level of facilities. And each state needs to have its own planning, like the state level midwifery roadmap with clear annual targets. And I know some states already have their state midwifery roadmaps. We must also create demand through campaigns.
Madam, 3 more minutes, please.
Yeah, I'm towards the end. So, awareness through campaigns and referrals by frontline health workers, community engagement for building trust and boost service uptake, legal recognition as a distinct cadre for midwifery professional would be helpful and important. encourage gender inclusion by including male nurses in midwifery to diversify the workforce. And because this is a new initiative, the performance needs to be monitored through indicators like vaginal birth rate, cesarean section rate, ANC coverage, etc. And we need studies on midwifery in this country, in India, to generate evidence and guide midwifery service initiative program. So UNFPA is deeply committed to service midwifery services in India and amplify its progress and impact through collaborative partnerships. So for India, midwives are essential in both crisis and everyday care. On behalf of UNFPA, best wishes to all midwives, their trainers, and everyone supporting midwifery services in India. Thank you. Over to Bharti.
Thank you so much, ma'am. Thank you so much. I think I was quite excited now. Everybody has joined. Around 400 odd YouTubers have joined us. So I just wanted to wish them a very, very happy midwifery day, International Midwifery Day. And thank you for waiting for such a long time to join us in celebrating the International Day. So I just want to once again repeat 2-3 things. I think the president should allow me to do so because they have just joined. The International Day of the Midwife is annually celebrated on the 5th May and was established in 1992 by the International Confederation of Midwives to celebrate and raise awareness about the midwifery profession. And this day is to celebrate the crucial role midwives play in providing sexual, reproductive, maternal, newborn, child, and adolescent health services. The day highlights their vital work in caring for women during pregnancy, childbirth, and postpartum, and raises awareness about the importance in global health, especially in crisis situations. Midwives can deliver 90% of the essential sexual, reproductive, maternal, and newborn health services, and their work can save millions of lives, according to UNFPA. So, theme for International Day of the Midwife, I think Madam has unfurled. Maybe if you're joined late, we are going to send the recording which we have done on the Zoom, so which will be again linked with the YouTube, which you can see what Dr. Saswati has told about unfurling about the themes. So you can hear her on the YouTube, which will be given at around 2:30 again. So we'll combine the first half and the YouTube now, which is there the second half. So thank you for very much for joining us. And I can see here in India, we have nurse and midwife. We do not have we only midwifery. We have nurse and midwife with minimal resources. You can all take care of the patients. Thank you very much. Now we have with us Bijoli Sinha. Ms. Bijoli Sinha is working as lead nursing and midwifery in Jaipago, India. Ms. Sinha is a master trainer of Dakshata, Manyata, and quality maternal and neonatal healthcare training. She has presented oral presentation in Global Maternal and Neonatal Health Conference 2015. She is author of abstract, namely Importance of Periodic Assessment of Competency and Knowledge to Sustain the Quality of Care during childbirth, and a study, which is a study from Rajasthan, India. And she has also co-authored the Sustained Adherence to Quality Standards in Labor Rooms in Maharashtra, India, published by International Federation of Gynecology and Obstetrics. She has co-authored Improving Quality of Intrapartum and Immediate Postpartum Care in Public Facilities, Experiences and Lessons, and she has also contributed to Midwifery Mentoring Guideline. Now, I request Ms. Bijoli Sinha to speak on role of NPM in midwifery-led care. Over to you, Madam Bijoli Sinha.
Thank you, ma'am. And good morning, everyone. And wishing you all happy International Day of Midwife. It's our immense pleasure to represent and also represent the work of Jaipago, as well as how the nurse practitioner in India, they are contributing toward maternal and neonatal health services. Madam Bharti, can you make me co-host? Because I'm not able to share my screen.
Jaiveer, please
Yeah.
make Madam co-host.
So it's we were been honored to join by all the nurse midwives and midwifery practitioners who across India. I wish all of you happy International Day of Midwife. And this year the theme, as Saswati ma'am has already unfolded the theme of this year. So I recognize all of you as the forefront of every crisis, because you are the one who handles, who identified the processes in every women who come across midwifery-led care services. So I'll before I start, so I'll be joined by Miss Vimal Kumari. We'll be hearing from Vimal Kumari detailed about how what are the role of NPM. But prior to that, I'll just brief you about midwifery-led care services and how we are establishing MLCUs in India. So if we see,
Bijoli, you can make it as a slideshow, and please be brief. We have only 5 minutes for you.
yes,
Yeah.
yes. So as all of us, we know about labor room care, but additionally in 2024, Government of India has shared the guideline, which already been talked, but it is basically to promote the physiological services. So when we talk about midwifery-led care services, what change we usually understand from midwifery-led care is basically we wanted to have a compassionate, respectful maternal care, and cadre who are very trained and qualified to identify the high risk in advance in OPD, as well as they do take care of a portion of women who are low risk, can decongest the obstetric unit, and they are master of promoting physiological birth, and they provide cultural sensitive, gender responsive care, and moreover they also work on promoting physiological birth. So if we consider the midwifery-led care model, it's basically a midwife or a group of midwives who are qualified midwives in India, providing antenatal, intrapartum, and postnatal continuum of care. The settings are in India are alongside, means into the existing hospital nearby the labor room, as well as in antenatal area. The midwives, NPMs, are also practicing along with in the existing system. So in the critical elements which we consider in midwifery-led care are basically to continue providing care, continuum care to a woman who comes for antenatal pregnancy, labor, and postnatal period. And if she require any kind of collaboration, if she identified as a high risk, anytime the midwives consult and they do collaborate with obstetrician and other other healthcare team member, and they do develop a mutual trusting relationship over time across their pregnancy journey. And midwife or midwifery-led care or midwife doesn't refer only to an individual midwife, but rather a team of midwives who are working all aligned with the same philosophy. So if we would like to establish a midwifery-led care services and operationalize, it need operational care guidance, which Government of India has already shared, HR planning, stakeholder sensitization, infrastructure strengthening, interprofessional collaboration, establishing quality assurance mechanism, and strengthening recording and reporting, because these are the integral part which will help the system to make the MLCU more functional. So just a brief of, okay, if we talk about midwifery-led care in existing services, so every woman who comes in OPD, they can opt for, if she is low risk in screening area, she goes to midwifery-led OPD. And if she identifies with any high-risk condition, she refers to obstetric OPD. And if she comes with labor pain, the women goes to triage room. In triage room, they triage and they identified whether the woman has any high risk or not. If she's a low risk, she goes to midwifery-led care unit. And if she has again any high risk condition, she is referred or she is she will be referred to obstetric labor room. So this is from MLCO guideline, as we have already spoke about. So in any moment, if the women need any kind of develop any high risk condition in midwifery-led care, so they will basically do the collaborative care, or if it can't be managed, then the women will be referred to obstetric unit. Now, this is my immense pleasure to call Vimal Kumari. She is an NPM at SMTI SDH Danapur, and she has completed her course in August 2024. So, and maybe we would like to hear directly from Vimal. So, Vimal, over to you.
Good morning, respected ma'am, and thank you, ma'am, Bijoli ma'am. Good morning,
Vimla madam, 1 minute में आपको introduce कर दूं?
Okay,
Can
okay,
you
ma'am.
just close it? Can you close it? You're sharing, please.
Yeah.
Thank you, thank you, thank you. Can you? I think हमारे साथ ये जो विमल मैडम है, we are very glad to have her because she's a nurse practitioner, midwife. So I'm very glad to have her as a nurse practitioner and midwife. She's from SDH Danapur, Patna. She has 10 years work experience as staff nurse and 8 months work experience as NPM. She is a quality circle team member in Lakshya. Now I request Madam Vimla Kumari to share her experience as NPM. I think she will speak in Hindi, isn't it? If you can speak in English, it's good. Otherwise, Hindi is also good. No problem. Go ahead, madam. Over to you.
Thank you, ma'am. I am Vimal Kumari, NPM posted at Midwifery-led care unit in SDS Danapur in Bihar. I would like to express my gratitude for Indian nursing for giving me an opportunity to share my experience as NPM. As we celebrate the International Day of Midwife, I am honored to represent the midwife from Bihar. Today, we recognize the tireless effort of midwives who stand at the forefront of every crisis, providing life-saving care to women, newborn, and their families. The theme for this year, Midwives Critical in Every Crisis, resonates deeply with our experiences. We have seen midwives navigate challenges from natural disaster to healthcare system disruptions, always adapting and responding with compassion and expertise. I am thrilled to share my journey as NPM and our role in managing MLCUs. In February 2023, 28 nurses like me joined in SMTI Patna and SMTI College of Nursing, IGMS, 18 months training. After successfully completion, we were posted in 3 MLCUs like SDS Danapur, GGSH Patna City, and DH Begusarai. I would like to show a video process. Let's see how NPM at SDS Danapur are playing a vital role to provide maternal and newborn health services. We provide holistic care, empowering women, family, and knowledge, support, and dignity. Now show the video, ma'am. Here our screening area where we screened all pregnant mother and find the mother is if non-complicated, then we send to midwifery OPD. Here we see the mothers by NPM, and here we do PA examination for mother in for their fetal development. And here the area for exercise, birth preparedness complication, counseling, exercise, diet, nutrition. And this is the area of triage unit where we हम लोग यहाँ discriminate करेंगे कि mother non-complicated, otherwise complicated. If mother is non-complicated, then we send to the MLCU area, and if mother is complicated, then send to the labor room. Here, this is our MLCU where we facilitate the birth of the woman with physiological birthing process. Here our some exercise and this is the postnatal area where after baby delivered, then we send the mother and give the care also, and mother and baby also provide care. Now This is our role. Our role in also antenatal, postnatal, intranatal, and continuity of care. Administration role also we play because development of duty roster as per hospital policy, coordination for ensuring regular supplies for MLCU, coordination with facility with DSMM or HM, ensure the NPM practice as per their role of scope of practice, conflict resolution and smooth internal coordination, monitoring adherence to quality standards in MLCU, community sensitization, also ASA and Anganwadi, mentoring and clinical preceptorships of for new NPMs, because here second batch also come and we monitor and supervise the second batch NPMs. Supervision of midwifery-led care services, ensuring data driven, because we doing the reporting also, generate evidence on midwifery-led services, organize as well as participate in continue professional development session. Hello. Here, educators also came, and their also role, midwifery educators play a dual role for supervising and mentoring the NPMs during their clinical practice session, alongside performing clinical practice themselves at MLCU at the hospital attached with SMTI. As we celebrate today, let's acknowledge the resilience, expertise, and compassion of midwife worldwide. Let's recognize the critical role in shaping and future of maternal and newborn health. There are some glimpse for my experience from working in SDS Danapur. Mothers feel very happy after delivering a baby. They come in OPD and by name searching me. It's their skill. Thank you, ma'am.
Wow. Thank you so much. You took us to the MLCU through your video. Thank you so much, Vimala Kumari ji.
Thank you so much.
बहुत ही अच्छा बात किया. I mean, very nice to hear you and your experience as well as NPM. Many of the students are getting encouraged by Vimala Kumari to be a NPM, isn't it? I'm hearing yes. I'm hearing yes. Anji.
Vimal
Kumari. Yes, and Vimal Kumari. Yes, ma'am. So I'm really thankful to you for us to take to the MLCUs and sharing your experience. And they're all positive experiences, isn't it? You're all enjoying, right? You're all enjoying giving the midwifery care. So thank you so much. Thank you for coming over here. I think I can hear the students and other faculty in midwifery that they would like to be a NPM. So there are the states are conducting the entrance examination. Yes, it's only for the government institutions and the government. I think the private can also join and can take the entrance examination to be take the course in NPM. Thank you very much, Vimala Kumari ji. Thank you very much.
Experience. Can I show?
Anji? Yeah, we don't have time. We'll take at the end, madam. Okay, we are chief guest is waiting. We'll take at the end. We'll take at the end. Okay, thank you so much. Thank you so much. Okay.
Thank you.
Now I welcome our chief guest, Dr. Pawan Kumar Ji, Additional Commissioner in charge, Maternal Health and Immunization, Ministry of Health and Family Welfare, Government of India, with virtual bouquet of flowers. So I will please welcome sir with the virtual bouquet of flowers. Sir is a doctor. I think somebody's mic is on. Will you please close it? Somebody's mic is on. Sir is a doctor by profession. Sir has many postgraduate degrees on his stride, including MD, DNB, MBA, PG, DHFM, PG, DHM, MNAMS, MAHA, MI, PHA, and MIA, PSM. Sir, it's such a great, you have so many of degrees. And we struggle to have one degree also. Experience of 25 years in public health and care management, planning policy, implementation, monitoring, supervision. Sir is also chairperson and convener member of more than 30 national expert groups and committees. He has executed more than 30 public health projects at national state level. Sir has published and presented more than 90 research papers and national and international journals, conferences, and has written chapters in books in the area of public health, associate editor for Journal of Advanced Research in Medicine, treasurer of Indian Society of Hospital Waste Management, and is also a life member of many professional bodies like IAPSM, IBHA, IMA, AGI, ISHM, WM, AACHHA, AHA, IEA, EFI, and IAE. And he's also a recipient of more than 29 awards at national state level, recipient of Excellence in Public Health Award, 2017 awarded, Ambassador for Peace, so for Universal Peace Federation by Social Council of United Nations in the year 2021. Sir's biopara speaks volumes of his work. Now I request our chief guest to address the participants. Over to you, sir. Thank you very much.
Thank you very much. And at the outset, happy International Day of Midwives 2025. And for the dignitaries which are connected virtually from their offices and working places, President INC Dr. Dilip Kumarji, Vice President Dr. Jogendra Sharma-ji, Secretary INC Sarvjit Kaur-ji, Bharti-ji, Asha Madam, and Dr. Saswati ji from UNFP and other colleagues which are connected virtually, and all educational institutions, nursing institutions which are listening to us today on this very important occasion of International Day of Midwives. Greetings to all of them from Ministry of Health and Family Welfare, Government of India. It is both a privilege and a moment of profound pride to join this significant virtual gathering hosted by the Indian Nursing Council. I extend my heartfelt appreciation to the organizers for bringing us together under the impactful theme, that is the midwives critical in every crisis. So it's a very, very important critical theme this year. This theme could not be more relevant today. In every crisis, we know, be it pandemic like COVID-19, where we have experienced everyone, natural calamities which happen in hard to reach area, hilly areas or conflict zones. Nurses have consistently stood as the first and often the only line of defense for maternal, newborn, and other healthcare services at the grassroots level. And they are the only line of defense for all care services which are being provided through healthcare services, health facilities, down to the line till the villages. Their unwavering presence, especially during COVID-19 pandemic, was nothing short of a heroic kind of activity which was done by all of them as a team members. I recall stories from the states where nurses clad in PPE for long hours during the COVID-19, and then right now also they are standing for long hours to support our mothers for having a childbirth, offering not just a critical clinical care, but emotional strength during that vulnerable phase when families were unable to be present along with the mother while giving a birth to their babies. Their dedication ensured that dignity and compassion remained at the heart of care even in the most trying times in our healthcare system. Since 2018, India has made a remarkable progress in formalizing and strengthening midwives as a distinct and essential pillar of our healthcare system. With the establishment of 8 national and 23 state midwifery training institutions and the rollout of midwifery-led care units in high caseload facilities, we are building a cadre pool of nurse practitioner midwife, which are responsive midwives and which will take care of our normal birthing for the mothers, which are happening in the field area where the high case load is there for the deliveries. These are not just administrative milestones, they are transformative lifeline for 29 million, means 2.9 crore pregnancies, which are happening in our country on a yearly basis. Midwives are not merely medical professionals, they are educators, advocates, counselors, above all, agents for change in healthcare system, let it be a maternal, childhood, or any other services. They offer a woman-centered approach to maternity care that promotes natural birthing, reduces unnecessary medical interventions, and build trust, confidence in birthing processes in the community. I still recall my visits to different states, districts, or block level in earlier years when expectant mothers were often giving birth in overcrowded rooms with minimal privacy. Then emotional support was lacking at that time. But with the progression of time in last 1.5 decade, we are seeing a visible shift in labor rooms. Our cleaner, respectful maternity care is being emphasized, and the presence of our midwives in their distinct pink uniform or whatever the color code they have chosen is now a reassuring sight for all of us. They offer birthing positions of mother's choice, guide them through physiological childbirth without unnecessary medications, and manage normal deliveries with skill and compassion and dignity and pride. This is a revolution in progress which is happening in our country. While our midwives initially were involved in a high caseload facility in selected states and districts, now the expansion is gradual, but is happening in other states and the district level where the high caseload is available. And we have also released very comprehensive guidelines, whatever is required, like SOPs, curriculum design, scope of practice, financial guidelines, and ME and NPM course curriculum also. These resources are enabling states to roll out this program very effectively to embed midwives within our existing system, ensuring quality and sustainability for a long term. Means the institutional mechanism should be there, from establishment of MLCUs, guidelines to learning resource package for NPM or midwifery educators. Our approach is both structured and inclusive for all healthcare services. However, no progress can be sustained without collaboration, because it's a collaborative effort, whether it is MLCU or OLCU, it's a collaborative effort with the gynecologists or other healthcare providers. It is imperative that all stakeholders, central and state government, healthcare institutions, nursing councils, academic bodies, development partners, community healthcare workers, they come together for this important endeavor. Now it is a time to formally create and integrate the midwives and midwifery functions within a given pool of nurses as a NPM, wherever they are having a leadership quality, and they are willing to devote 18 months for the normal practices of midwife as per the competency being provided by the International Confederation of Midwives. A clear pathway for development, mentoring, and career progression needs to be institutionalized, and the states need to take a proactive action in that direction. We need to build awareness at the grassroots level, ensuring that communities, they understand, they trust midwives-led care units, and every woman, regardless of geography, income, or background, deserves access to quality, respectful, and compassionate maternity service in our country. As we recognize the extraordinary contribution of midwives today, let this be more than a moment of celebration. Let it serve as a reaffirmation of our collective responsibility to place midwives at the center of our maternal and child and newborn healthcare strategy, which is happening in the country, not just during emergencies, but as a permanent and empowered presence in every healthcare setting. Let us commit to building a future where every birth is safe, every mother is safe, with having a respectful maternity care in the country, and every midwife is valued. Thank you. Thank you very much, all the audience which are virtually connected online today to have with us for this celebration, a very important occasion. Over to you, Bharti, please.
Thank you, sir. I'm so joyful. I'm so overwhelmed to say that around more than 745 people have joined us on the YouTube, and many students, because the principals have made them sit in the seminar hall, and many students and the faculty have also joined the YouTube link, so that we don't have number. I think around thousands have joined us today. Thank you so much, sir, for telling about the NPM and NPME. Yes, sir, we need to showcase whatever the NPM has done on this day to celebrate IDM. Thank you. Thank you very much, sir, for gracing and coming and accepting the request by the Indian Nursing Council. Thank you very much, sir. Now I request Madam Jashuben S. Patida. She's a Vice President of SOMI, the Society of Midwives India. Madam is a postgraduate in pediatrics. She's a former lecturer and held the position of Registrar Gujarat Nursing Council for many years. And she was also an executive member of Indian Nursing Council for many years. Over to you, Madam, to address the participants. Jesu madam. I think her link is out. Can I request now our next speaker, Dr. Jogendra Sharma ji, if sir is there, Dr. Jogendra Sharma ji. Sir is also not. Sir, can I request the President Indian Nursing Council to address the participants, please? Let me introduce our President Indian Nursing Council. I think we all know our beloved sir, Dr. T. Dilip Kumar, President Indian Nursing Council. He's an ex-project director, JF18 program, and ex-nursing advisor to the Government of India. Sir has a long-standing 50 years of experience nursing. He has started his career as staff nurse and retired as nursing advisor to the Government of India. Sir was also a member of Global Advisory Group on Nursing and Midwifery of WHO. Sir is bestowed with prestigious 2023 Princess Sri Nagarendra Award by Princess Mahachakri Throne for his unwavering dedication to the field of nursing and his contributions to the Indian Nursing Council over a career spanning nearly half a century. He's also been bestowed with prestigious Karnataka Rajyotsava Award on the eve of celebration of Karnataka State Foundation Day on 1st November 2024 by the Government of Karnataka. Sir is as the first nursing professional to be selected for this award under the category of social service. These awards speaks volumes of his achievements in nursing, which I am not going to elaborate. Now I request our beloved President Sir to address the participants who have joined us on the YouTube. Over to you, sir.
Good morning. On the occasion of International Midwife Day, I extend greetings from the Indian Nursing Council to all the nurses and midwives who have joined from the length and breadth of India. I am also happy to hear from Bharti that so many students are also joined for this program. That itself speaks volume of the interest and the commitment which the midwives are providing in our country. So I am very distinguished chief guest. Distinguished chief guest of the today, Dr. Pawan Kumarji, from the Ministry of Health and Family Welfare, and also from the UNFPA, we have a Madam Saswati Das, who is a champion for the midwifery community in India, and also we have a team of Japago with Bijoli's Sinha, and also I'm very happy to see from the ground level how nurse practitioner midwives are providing the services from the field level. I think that is most important. And Dr. Asha Sharma, Jogendra Sharma ji, and I think we had somehow, hopefully, Bharti, please see that, talk to Jesu Patidar.
Yeah, Madam Jesu has just joined, sir. She has joined now.
Okay. So we are very happy to have Jesu Patidar, who worked with the Indian Nursing Council and also with the Gujarat Nursing Council for a long time, who was one of the person who associated with us to start the nurse practitioner midwives by the Indian Nursing Council. Today, how happy I am. I can't believe it because I am the person, I think I have passed through the journey. I passed through the journey of the maternal and child health services, starting with my journey as a deputy nursing advisor, was totally, I was in charge of the training of DAIs, then intensification of DAIs training program, and as a program officer for the establishment of the sub-centers and also the training of ANMs and LHVs, who are basically involved in providing the basic essential services for the maternal child health services. So now I am seeing in 2025, we have an established the nurse practitioner midwives professionally. I think many of the nursing and midwifery professionals might be seeing to reach this day how difficult the Indian Nursing Council to start the NPM program, Nurse Practitioner Midwives, of 1-year program in collaboration with the West Bengal government, started the program of the Nurse Practitioner Midwives. With due respect to the medical fraternity, the word of a practitioner was somehow or the other was not taken rightly. There was a lot of opposition which we experienced, and with great difficulty, the Indian Nursing Council, in collaboration with the government of West Bengal, started the nurse practitioner midwives. And that journey has continued. The UNFPA and global international agencies supported for this nurse practitioner midwife program. And again, I am very happy to see that the first the SON report, State of the World Nursing Report, and the State of the World Midwifery Report, which was released by the World Health Assembly, and coming out with the strategic direction for nursing and midwifery as a resolution at the global World Health Assembly level. And the 4 important themes as woven in these reports, like investment. I think the World Health Assembly is telling to all the countries to invest more money for the nursing. I am very happy to inform that. I think the live example which our additional commissioner was explaining, how the government of India has the NHM has taken this initiative, and I would like to congratulate the Ministry of Health and Family Welfare for coming out a midwifery guideline in 2018. Though I think that itself speaks volume of the investment for the nursing and midwifery what the World Health Assembly has given. So in that direction, they at least know a policy statement, policy commitment was made by the government of India, National Health NHM, that 86,000 nurse practitioner midwives-led care units are going to be established. I think it's a great policy commitment. In the forum of the then Health Minister Nadda Saab was able to release the midwifery guideline, which that midwifery guideline has encompassed the whole concept, how the roadmap has been laid down in the midwifery guideline. So we are very happy to see how JAPAGO and the UNFPA has worked to see that, to make it a reality. I am very happy to see that Vimal Kumari, with how she is working, and I have seen some of the midwifery-led units in Wardha and all, how the community is looking in the OPDs for these our NPMs with a pink uniform, because they will ask, "Oh, pink dadi ko मैं मिलना चाहता हूँ." ऐसा that environment has been created. It's a great thing which is happening, because we are all working, the nurses and midwives, we are all working to save the lives of and especially providing the antenatal, natal and postnatal services to save the babies. I think we were very fortunate in this whole environment where the government of India, NHM, is providing the platform. It has given a big platform, which great difficulty we were able to come out with that. And I am very happy as a Indian Nursing Council president to tell you the scope of practice. The scope of practice has been no other profession in India. The scope of practice has been prepared by the Indian Nursing Council with the approval of the Ministry of Health and Family Welfare. Now when the new Nursing and Midwifery Commission which is coming up, they are going to take the scope of practice to all the category of the nursing and midwifery professional, which will have a big impact and outcome in the healthcare delivery system. Again, we had a lot of struggle. I think I'm very happy to inform you that while preparing the curriculum, one of the biggest stakeholder, which is very important in these midwives, the FOXI, the Federation of Obstetrical General Society of India, was taken in a board in the total curriculum of the midwives. So therefore, we are everybody with so much motivation, and Lancet we gave a very good evidence, global evidence. I think the government of India took that evidence to roll out this nurse practitioner midwifery program. Now I request our Pawan Kumarji to take forward, because many of the states have already rolling it out. It has to go in a big format. In a big format, I think we as a regulatory body from the Indian Nursing Council will be willing to provide all support. And we are working very closely with the JAPAGO and the UNFPA to strengthen this program, to take it to all the states, to all the districts. The government of India's aim of NHM to have the 86,000 the nurse practitioner midwives to be trained. I think we will be willing to work together to see this dream of the Ministry of Health and Family Welfare to make it to happen. So therefore, I think this is a great moment, and to showcase the at least know the video which our Vimal Kumari showed to the people. Yes, this can happen. So therefore, we are very positive. And we should take it forward, and we all the international agencies, government of India, regulatory bodies, as Pawan Kumarji mentioned, we all have to work together to make it to happen. So therefore, since I have gone through the journey from the 1980, I am telling you, Health for All by 2080 in Rural Health Division, we were the people working for the male health worker, female health worker, and the DICE training program. And from there, now I have seen a professionally, international standard, international, the Confederation of Midwives, which is globally coming out with the evidences. So we are able to reach out that evidence now. Yes, India can do it. So therefore, it is all the good work of the so many people who work behind the screen to make it to happen. And Indian Nursing Council, we faced a lot of struggle to start this NPM program. And I always remember that how government of West Bengal and the Indian Nursing Council jointly to start this nurse practitioner. At that time, to tell you many of the people, we got a letter from the United States. Some of the Indians wrote to the government of India, India should start the nurse practitioner program. So since I was working in the ministry, I have to tell them, after when our minister called me, I have to tell them, sir, already India started. So we had a NPM syllabus, we started this program. So therefore, I am so much happy to this day. And I think the Ministry of Health and Family Welfare is so proactive, we should take it forward to see that all the states, in all the districts, to have this nurse practitioner program, because the respectful maternity care, which these nowadays we are seeing in many parts of India, that should happen in every district. Then only we should feel happy. So once again, I think many of the students who have joined, I think you should feel happy. This is another scope of a category where respectful the maternity care you can provide, and also another specialization in the nurse practitioner midwives. I know some of the nurse practitioner midwives are having a demand of to make it this program into 2-year postgraduate residency program. Indian Nursing Council has taken already policy decision that this 18-month program is also on the lines of the nurse practitioner critical care program, a postgraduate residence. So we have already developed the 6 months additional curriculum, and shortly we will be sending to the Ministry of Health, so that there are some logistics which we have to work, because some of the nurses who have been selected by the state government, they are the GNMs. They have not undergone the BSc nursing program. So this is the one we have to work out how best to make it happen, the new things to all the people. And we have to work with some of the state universities, because once they have to get the postgraduate MSc level nursing in the nurse practitioner, we have to take them into the board. We are working on that program. So once again, I would like to extend greetings to all of you on this very important International Midwives Day. And the May 12th, the second the World Health Assembly is going to release the May 12th. The ICN is going to release the second SON report, State of the World Nursing and Midwifery report. They are going to release in the May 12th, and they are going to come out with some futuristic resolutions to all the governments. At least we, as I said in the fourth theme, we have already, the ministry has committed investment. The creation of the post is one of the challenge which I think we have to address. Then the leadership and the service delivery. These are the 4 themes. I think we have to work for those remaining 3 themes. The first theme is well done by the government of India. So we have to work for the remaining 3 themes. When then we will be able to satisfy on the basis of the strategic direction, nursing and midwifery resolution, which was passed by the World Health Assembly 2020. So wish you all the best. And this is a good motivation to take forward. Thank you very much.
Thank you very much for your motivational speech. I think the students will see that they can also be one more NPM category is there for them. And we have a scope of practice, as I said, so which is available on Indian Nursing Council website. Now we have our Jasupatita madam with us, and I've already introduced you to her. Now over to you, madam, to address the participants.
Good morning, Bharti, and thank you very much. I am sorry, due to some, I do not know exactly with the technical error. At the time of this, I lost the connection, but I am again able to join it. Good morning to everyone. Respected all dignitaries, speakers, representatives from international agencies like JAPIGO, UNFPA, and respected President of the Indian Nursing Council, Dilip Kumar sir, Asha ma'am, Bharti, entire team of the Indian Nursing Council, and Secretary ma'am of the Indian Nursing Council. I wish a very happy International Midwives Day to all those who are watching this through the virtual link. I am here, after say working and retired from the nursing, more than 50 years I think I have passed in nursing, and I was nurse midwife throughout my life. So in India, the nurse and midwife, these are together things. We do not have the separate midwife training. It was there before many years, but then it was realized, especially after the Britain rule and post-independent, the midwifery was integrated with the nursing. And then it was realized that we need to have the autonomous special midwifery course to strengthen the midwifery services, to save the lives of the mother, because it requires some very specific special training. Special skills are required to take care of the maternal health and throughout the pregnancy. We were able to reduce the MMR by controlling, mota things we were able to control. But to prevent the death and to preserve the life of the mother and child, we need some specific skills now, because the reasons, the causes of maternal death, they were so complicated, and day by day, the complexity is increasing. And therefore, the need was felt to have the specially qualified midwives. And we took a decision to have the midwifery training after completion of the nursing course. Many nursing skills are used to deliver the midwifery services. It is not that nursing knowledge is something which is extra. It's a part of midwifery training. And as sir told us, the OSID program was started. 1 year NPM syllabus was prepared. And at the same time, the Society of Midwife was established in around the year 2000 to speak and advocate for the midwifery service, strengthening the midwifery service for the health of the mothers of this country. The Society of Midwives is as you know, it is a small society registered in Hyderabad, having its headquarters in Hyderabad. Today, the society is having membership around, say, 15,000 or so. The day by day, the popularity of the Society of Midwife is increasing. We have now presence in almost all states of the countries. Memberships may be less, but they are active members. If we look today, I think almost all states and many institutions, they are motivated to celebrate the International Day of Midwives, along with the motivation and support and guidance of the chapter secretaries, usually in the colleges of nursing or at the state level. The main purpose of the Society of Midwives, when it was established, that time it was thought, okay, mainly we will do the advocacy role to strengthen the midwifery services, to highlight the role of the midwives, and to make it as an autonomous profession as a midwife. Today, as the previous speakers told, midwifery is developing in our country. It is accepted as a practitioner course, which is usually at the master levels, and we are also having post-basic course. Until SOMI is continuing to develop the role of the midwifery, to expand the role of the midwifery, and to support the midwives, those who are practicing at different level in different settings. Our networking of various chapters, we are motivating the nurse midwife practitioner when they are facing one or the other issue in their working situations. Still, a lot of things is to be done by the Society of Midwives of India. We are also affiliated with the ICM, member International Confederation of Midwives. Our office bearers are regularly participating in ICM activities. The structure, if I say of the structure of the SOMI, we have governing councils. Governing council is usually the senior members who were usually founder members and the presidents from the establishment of the society. And executive committee members, we are only 4 members in executive committee: president, vice president, secretary, and treasurer. Very small structure, but we are working very hard, and our efforts, our actions are recognized by the government of India. Now, SOMI's opinion is taken we were involved in the development of the SOMI's guideline. We are advocating at various state level. Few states have involved the SOMI representative in their state task force in midwifery. It is the directions given in the state midwifery guidelines. We are working collaboratively with the agencies like White Ribbon Alliance is one of them. We are regularly conducting more than 30 symposium every year on the essential newborn care with the help of the Himalayas group of companies. We regularly conduct the conferences, workshops, and seminars. Usually the conferences, we get representative from all the state, where we have, along with the scientific and plenary sessions, we have the skill labs also. The demonstrations are being done, and various educational activities are being undertaken at the time of conferences. So SOMI is trying to bring the midwifery profession in a focus, or in a independent or autonomy within the profession, with the collaboration of our counterpart, that is mainly the medicos, OBS, and gynec people. Yes, and like we are just growing, Society of Midwives is expanding day by day. If I come to the theme, today's theme, this year themes of the International Day of Midwifery, it is focused the need of the midwife in the time of crisis. So a lot of things has been told about the crisis, and we all know it may be a natural crisis, man-made crisis, system failure, so many things. But at the time of crisis, the need for the maternal and child health is increased. Usually it increases. It is said, and it is documented by one of the document of the Jalpaigu, that chances of death, of maternal death and child, is double at the time of crisis than the normal situation. So it shows how the need for maternal and child health population area is increasing during any kind of crisis. It may be earthquake. We have seen the latest video, which was very viral video, how the nurses in neonatal units, they were holding the trolleys of the small neonates. The trolleys were rolling out of the way and then preventing their securing those trolleys, how they were struggling, they were falling on the floor, they were sprawling on the floor. So this is the role of the nurse during the earthquake. We have also seen this at the time of earthquake in Bhuj. 2002, we have heavy large-scale earthquake where hospitals were collapsed, sub-centers, more than hundreds of sub-centers were destroyed. 3 sub-district hospitals were collapsed. Many nurses, they have lost their life also. But at that time, the Indian Medical Association has established one hospital in Bijoli. There they were getting a lot of cases of labor room, maternal health and abortion. So they have employed one senior nurse midwife along with the team of, she came along with the team of 5 nurses from Baroda. And when we interacted with her, she told, okay, she is getting many cases of premature labor. Maybe reason I am not sure, maybe the stress of the earthquake or anything, but when any such crisis come, the demand for the labor room and abortion care is increasing. Usually the children are neglected in any any crisis situation. We have heard or read the story of Gaza, Ukraine, Nigeria, how the women and children, they are neglected during crisis. And most of the time, only the nurse or the midwife is available to take care of them. No other health professionals are available. We have witnessed recently over this pandemic, corona pandemic, COVID pandemic. Hospitals were closed. Labor rooms were not functioning. Most of the health workforce was deployed in the COVID care centers. Few nurses were taking care in the labor rooms, but they have done it successfully. So nurses and midwives are always there. They do not leave their place of work. They are committed people, and therefore it is our duty. It is a duty of the government, it is duty of the professional association like us, duty of the society to strengthen their hands to serve the people in a better way. Now, to serve in any crisis.
Madam, can you close in the next 1 minute, please?
Yeah, so we need to strengthen our training, to add few topics in our training, like how to work during crisis, because there will be no transport, maybe electric failure, water failure, no helping hands. So we need to add few topics in our training, plus something guideline or in the scope of practice, some extraordinary freedom to work at the time of crisis. I think with this, I conclude, I stop here. I am really thankful to the Indian Nursing Council for inviting me, giving me this chance to interact with you. And I am thankful to all the audience who are listening to me. Thank you very much. Thank you once again.
Thank you so much, ma'am. Thank you so much, ma'am, for accepting our invitation and addressing the participants as the Vice President of SOMI. Thank you so much. I think now all the students who want to be a midwife can also be a society of midwife. They can be a member. Madam has told about organogram and how can he be a member. So you can also be a member of SOMI. And now I request our Vice President, sir, Dr. Jogendra Sharma, sir. Sir is a National Florence Nightingale Awardee presented by the President of India in the year 2015. And sir Sir is a Dean Faculty of Nursing RUHS, Principal Government College of Nursing Jaipur, President TNR State Branch. Sir is also a former Registrar Nursing Council. He has over 34 years of experience in nursing leadership and administration on various roles, pioneer in development of nursing education system in Rajasthan. He is a member, Draft Committee NNMC, Bill 2020, member of Academy Council, BOI and Research Committee RUHS, and is a resource person for many national and international conferences. So over to you, the Vice President, sir, to address the participants.
Thank you, ma'am. Thank you, Bharti, ma'am. आज 5 मई
सर
इंटरनेट
आपका सर वीडियो ऑन कीजिएगा सर प्लीज, आपका वीडियो ऑफ है।
आपके यहाँ से हो पाएगा मैम?
तो मैंने कर दिया, देखिए सर, हमने कर दिया है।
हाँ
यस सर।
जी मैम। आज 5 मई इंटरनेशनल डे ऑफ द मिडवाइफ्स पर इंडियन नर्सिंग काउंसिल द्वारा आयोजित वेबिनार में हमारे आज के मुख्य अतिथि डॉक्टर पवन जी, नर्सिंग जगत में अपनी दूरदर्शिता के साथ पहचान बनाने वाले हमारे प्रेरणा स्रोत सम्मानित डॉक्टर दिलीप कुमार जी, सेक्रेटरी में कर्नल सर्वजीत कौर जी, पीसी मेंबर डॉक्टर आशा जी, भारती मैम, जस्सू पाटीदार मैम, बिजोलिया मैम, सभी स्पीकर्स और इस यूट्यूब के माध्यम से वेबिनार में जुड़ने वाले सभी नर्सिंग प्रोफेशनल्स, मैं बधाई देना चाहूंगा इस डे पर हमारी सब मिडवाइफ्स को कि जिनकी एक दूरदर्शिता के हिसाब से देश ने उनको एक ऐसा प्रोग्राम दिया है जिसके माध्यम से कहते हैं कि माँ को जब माँ कहा जाता है उसमें एक रोल सबसे जो लंबा पेन होता है, लेबर पेन, सीवियर पेन, उस प्रसव के दौरान उस पेन को सहन करते हुए वो एक नई पीढ़ी को जन्म देती है। समय बदलता गया, आज के इस इनोवेशंस के युग में जब सबको लगने लगा कि इस डिलीवरी को किस ढंग से रेस्पेक्टफुल बनाया जाए और डेवलप्ड कंट्री में जिस ढंग से मिडवाइफ्स की एक अलग से भूमिका है, भारत में उसको किस ढंग से अंगीकार किया जाए, भारत सरकार ने इसका एक बृहद रूप में योजना तैयार करके हर स्टेट में एनएमटीआई सेंटर, एसएमटीआई सेंटर के माध्यम से एनपीएम को तैयार करने का बीड़ा उठाया है। भारत सरकार का टारगेट है कि लगभग 90,000 एनपीएम हम तैयार करें और 8,000 मिडवाइफरी लीड केयर यूनिट को हम बनाएं, जिसके माध्यम से मिडवाइफ्स के माध्यम से रेस्पेक्टफुल डिलीवरी और सीजरियन से बचा जा सके। मैं ये कहना चाहूंगा कि नर्सिंग के लिए मिडवाइफ्स के माध्यम से एक बहुत बड़ी महत्वपूर्ण भूमिका हम लोग निभाते हैं। आवश्यकता है कि हम अपने आप को इस ढंग से लीडरशिप में कैसे लाएं कि इस नए प्रोग्राम को आने के बाद चैलेंजेस भी उसके साथ आए हैं। कहते हैं कोई भी नई चीज जब आती है तो शुरू की पीढ़ी उसको बहुत परेशानी से निकलना पड़ता है और एक जमाने के बाद ये कहने लग जाते हैं कि जब एनपीएम भी चालू हुआ था बहुत कठिनाइयों को सामना किया। मैं सभी एनपीएम से निवेदन करना चाहूंगा, सभी एमई से निवेदन करना चाहूंगा कि इस प्रोग्राम के माध्यम से देश आपकी ओर देख रहा है। देश नर्सिंग जगत की इसमें एक अच्छी सी एंट्री चाहता है। हर स्टेट में कोई ना कोई परेशानियां इस प्रोग्राम को लेकर चल रही है। चाहे आपका कैडर बनने वाला मामला हो या आपके रहने की सुविधा हो या ट्रेनिंग में जो जो परेशानियां आपको अभी आ रही हैं वो किसी से छुपी नहीं। समय का साथ है, सरकार का बजट इसमें अच्छे रूप से दिया गया है। मैं सोचता हूं कि पहले बैच जो निकल रहे हैं इनको जरूर परेशानी आ रही है, पर जल्दी आपका कैडर बन जाएगा। और कैडर बनने के बाद हर स्टेट में जिस ढंग से एनपीएम अब निकलने लग गए, इनके एग्जाम के एनरोल होने लग गए, स्टेट काउंसिल्स भी इसमें अपना अच्छा सा भूमिका निभा रही है। मैं ज्यादा नहीं बोलते हुए आज मिडवाइफ डे पर सभी को बधाई प्रेषित करता हूं। सम्मानित दिलीप कुमार साहब को धन्यवाद ज्ञापित करता हूं कि आप हर डे को बड़े अच्छे रूप में आयोजित कराते हैं, जिससे सभी नर्सेज प्रोफेशनल्स को एक अपडेट मिलता है। पुनः सभी का धन्यवाद। थैंक यू वेरी मच।
Thank you very much, sir. आपने बहुत अच्छा एड्रेस किया and you have brought forward the challenges, issues of the NPMs. Thank you so much, sir. And
Thank you.
now I think we are coming on the last program of the day, but I would like to show an NPM experience video. It's only for 7 minutes. I think we'll all enjoy it. Just see what is NPM is all about. Can you all hear? Can you hear it?
जी।
थोड़ा वॉइस का ठीक कर दीजिए भारती।
Just a second, sir.
Care and reduce over-medicalization. In 2018, the Government of India took a landmark policy decision to introduce a new cadre in the health system, the Nurse Practitioner in Midwifery, or NPM, with an overarching aim to promote compassionate and respectful woman-centered care for women and their newborns. Globally, professional midwifery services are well known to significantly improve health outcomes for women and their newborns, as midwifery care focuses on promoting normal physiological processes and empowering women to choose where and how they want to birth. This contributes to an overall positive pregnancy and birthing experience. It is therefore of paramount importance to equip NPMs or professional midwives with the necessary knowledge, skills, and behaviors aligned to global competency standards set out by the International Confederation of Midwives, or ICM. In June 2022, National Midwifery Training Institute was operationalized at the Kasturba Nursing College and Mahatma Gandhi Institute of Medical Sciences, Sevagram,
where we have created a midwifery-led care unit, where midwives, they work under the close supervision of obstetrician to provide the normal labor. They also take care of antenatal care as well as postnatal care, and we are trying to create a facility to provide the quality obstetric care, respective maternity, and training the master trainers so that they can start the training program at various state midwifery training institutes.
This 18-month course is a competency-based program that offers a blend of academic and clinical training. Learners work closely with international and national midwifery educators, doctors, and nurses, where they learn the art and science of midwifery while working in a multidisciplinary professional team. Interprofessional collaboration breaks down silos, fostering a culture of mutual respect and trust. It enables midwives, doctors, nurses, and other healthcare professionals to share their unique expertise, ensuring a cohesive approach to care.
To be the National Midwifery Training Institute for the kind of services we give, and the nursing college, Kasturba Nursing College, was made the main place for this NMTI. Midwifery-led care unit, which we have developed next to the labor room. And to tell you very truthfully, we have seen the kind of transition which has happened, the kind of care which has been given to the women, the way ideally, laboring women should be given attention. So there have been so much of learning with the midwifery coming in.
So after a series of assessments, Government of India is identified Kasturba Nursing College as one of the important National Midwifery Training Institute.
So this is the first birthing room, and this room is the totally covered by curtains, and we maintain the privacy. And it is a great honor for all of us here that the teaching as well as the services that are being provided by them are given to us. And it is a great learning experience with them, because we as doctors, we moreover go towards interventions and instrumental deliveries. But with the help of midwives, even we have been able to learn, how to conduct vaginal delivery more efficiently without episiotomies.
जेव्हापासून मिडवाईफ इथे म्हणजे जे प्रोजेक्ट खोललेलं आहे तेव्हापासून पहिल्यांदा इथे जे डिलिव्हरीज आम्ही बघितली टॉपमधली बॉलवरची, त्यांना ते बॉलवरती बसून ते डिलिव्हरी स्वतः करून दाखवतात. म्हणजे हा बदल कधी पाहिला नव्हता, हा घडलेला आहे ते चालू झालं तेव्हापासून.
की मला ही संधी मिळालेली आहे, कारण आतापर्यंत जेवढे मी 15-16 वर्ष झाली जॉब करत आहे, जेवढा सॅटिस्फॅक्शन जॉबमध्ये नाही मिळाला, समाधानकारक नाही मिळाला. जेव्हा आपण डिलिव्हरी करतो एखाद्या मदरची, बेबी जेव्हा आपल्या हातात येते, त्यावेळेस आपल्याला एक जॉब सॅटिस्फॅक्शन खूप जास्त मिळते आपल्याला.
बॉल पर रोलिंग करना, उठक बैठक करना, चलना, वैसे एक्सरसाइज जो लेबर में आसानी देंगे हमें.
Congratulations! To attain the vision of Government of India and develop a dedicated midwifery cadre, we also need to invest in developing midwifery educators who can educate and mentor future NPMs in their journey.
Thank you, Bijoli, for sharing us this beautiful video. I think many would have been glad to see, and you know how Mama Bhartili is also used at the end to teach the students was also shown. I think the institutions which are watching should ensure that they take Mama Bhartili and train the students in that midwifery units, right? So, I mean, this is a good experience. I think Vimla Kumari, are you still there? Madam Vimla?
Yes,
Sir, she wants to give can you just give a brief 2 to 3 minutes experience, not more than that? Your personal experience you want to speak, right? Yes, only 2 to 3 minutes, not more than that. ठीक है? जल्दी से टिप्पा दीजिएगा. सबको भूख लग रही है.
ओके मैम एक्चुअली जब भी हमारे पास मदर्स आती है तो वो हमारे नाम से हमें जान जाती हैं, क्योंकि हम सारा कुछ अपना बताते हैं कि हम यहाँ पे मिडवाइफरी है, आपका ये को पूरा केयर देंगे, एंटीनेटल देंगे, इंट्रानेटल भी करेंगे और पोस्टनेटल भी करेंगे. तो हम अपना नाम भी बता देते हैं कि जब भी आप आओ मुझे मेरे नाम से खोजो और मुझसे मिलो और वो खुश होती हैं और आके पूछती भी हैं कि हाँ कहाँ वो मदर है। मेरी जो एनपीएम दीदी पिंक वाली थी वो विमल दीदी कहाँ है, हम उनसे मिलना है। ऐसे करके ओपीडी में वो हमें पूछती हैं और फिर वो आके हमसे मिलती हैं, हम उनका ध्यान रखते हैं। इवन वो लोग हमको लास्ट टाइम में थैंक यू बोल के जाते हैं कि नहीं आप लोग बहुत अच्छा केयर दिए और आपके बिहेवियर की वजह से हम और हॉस्पिटल छोड़ के हम आप दानापुर में आए और आपसे अपने सारे जान पहचान वाले को लेके आएंगे और यहाँ पे करवाएंगे, ऐसे बोल के जाती है वो लोग। सो बहुत अच्छा खुद में भी फील होता है कि कोई मदर इतना अच्छा से ये कर रही है कि उसका जर्नी है प्रेगनेंसी का वो नॉर्मल और सेफ और होता है पूरा। तो इट इज वेरी गुड फॉर अस। ओके, थैंक यू मैम।
Thank you, Vimla ji. Thank you so much. I mean, we are so happy to have you as an NPM and a Pink Didi. I know everybody look forward for you, and
hello,
working as midwife is different. Working as NPM with authority is different. That's what it shows, isn't it? With the authority, what you have, with the professionalism, what you have, and how the mothers come to you and say, "हम और दीदियों को और अपने friends को भी आपके यहाँ भेजेंगे." So I think that is a satisfaction what you have, not the salary, not the caterer, isn't it? Yes. So we are very, very happy to have you over here and to share your experience.
Yes,
I think the people watching you on the YouTube will be very, very happy. Yes. Any work we do, we work, everybody works, but when you give autonomy, you feel more happy to give to the mothers and the. So I'm very, very happy to have you here today. Thank you so much, Vimla ji. Thank you
yeah,
so
baby.
much, Vimal Kumari, madam. And I would like to say this, we are coming to the end now. I would like to say this quote, it is not just the making of babies, but the making of mothers that midwives see as a miracle of birth. The health of mothers and babies is a foundation of healthy families and communities, helping ensure hopeful futures for us and for country at large. With this, we are coming to the end of this program. Now I request Madam Jyoti, Deputy Secretary of Indian Nursing Council, to give vote of thanks. Madam Jyoti, who is on deputation to INC and has around 25 years of teaching experience. Over to you, Madam.
Thank you, ma'am. I am audible, ma'am?
Yes, ma'am. Yes, ma'am.
Yes.
Good afternoon to everyone. As we come to the close of today's meaningful celebration of International Midwives Day 2025, it is my great honor to deliver the vote of thanks on behalf of INC with a small quote: every human deserves a midwife, every midwife deserves respect. This year theme, as we are aware that midwives critical in every crisis, is not just a slogan, it is profound reminder of unwavering dedication, resilience, and courage that midwives demonstrate in the face of adversity. When the word wavers, midwives stand firm. On this occasion, I would like to extend our heartfelt appreciation to our respected chief guest, Dr. Pawan Kumar, Additional Commissioner, in charge Maternal Health, MOHFW from Government of India. Sir, your perspectives have illuminated the importance of empowering midwives and investing their training, support, and recognition. Thank you, sir. I extend our heartfelt gratitude to our esteemed guest, Dr. Saswati Das, Sexual Reproductive Health and Rights Specialist from UNFPA, so eloquently and powerfully unfurling this year's theme. Your insights have helped us all reflect on just how vital that midwives are not optional, they are essential. Thank you, ma'am. I would also extend our sincere thanks to our esteemed speakers, Bijoli from Japago, Mrs. Vimala Kumari, NPM from Patna, and our guest, Mr. Jasu Patidar from SOMI. So thank you for your gracing with us, your presence, and your words have not only enlightened us, but have also deeply resonated with the spirit of this year's theme. Your experience and reflections have added immense value to our gathering and to have inspired us, and it has inspired us to think more deeply about the vital role of midwives in times of both crisis and common crisis. Thank you all for your time, your wisdom, your unwavering commitment to this essential field. We are truly honored to have you all with us. Thank you all. So I would also like to offer our deepest and most heartfelt thanks to our respected President, INC, Dr. Dilip Kumar sir, who is recognized and respected around the world. So it is no exaggeration to say that your voice uplifts thousands and your action speaks volumes. Thank you for being a guiding light to this cause, sir. Thank you, sir, for everything, sir. I thank our Vice President, Dr. Jogendra Sharma, sir, for your unwavering support and inspiring leaderships are cherished by us. A special word of thanks to our dedicated officer always, Colonel Dr. Savajit Kaur ma'am, Secretary of INC. In Madam's absence, we wish to acknowledge appreciation and gratitude to her continued support for this event. K.S. Bharti ma'am, ex-Joint Secretary of INC, Dr. Asha Sharma ma'am, Senior EC member of INC and our INC team. Thank you for your hard work, attention to detail, and tireless commitment in putting this event together. Your efforts have created a platform to honor and celebrate this noble profession with the dignity it deserves. Thank you all, ma'am. And to all the participants, your presence here today reflects a shared respect and appreciation for midwives and their indispensable role in health system. Thank you for standing in solidarity with them. Thank you all. A special thanks goes out to the midwives present with us today, whether tuning in virtually or behind the scenes. You embody resilience, compassion, and courage. Your dedication in times of calm and crisis alike is a beacon of hope for families and communities around the world. Thank you all, midwives. Let us leave today not only inspired but also committed to advocating for midwives, supporting their work, and ensuring they are never left to face a crisis alone. Once again, thank you all, and let us carry forward the spirit of today in our arts and actions. Thank you all. Jai Hind. Thank you, sir.
Thank you, Jyoti ma'am. And I just want to say, because of the ill health, the Madam Secretary could not join us. Otherwise, she would have been the front and in front of you all, because she was not, she could not attend the Midwifery Day. But I convey her International Midwifery Day wishes to all our participants from our side and from the Indian Nursing Council once again. Jai Hind, and thank you for being there with us from the last 1.5 years. So thank you very, very much to our speakers and to our YouTubers who are watching us. Thank you so much. Again, we'll see you on 13th of May, but we'll not delay that day. So we'll see you again on 13th of May as International Day of Midwifery. Sorry, International Day of Nurses. We celebrated Midwifery Day today, and on 13th May, we are going to celebrate International Day of Nurses. Thank you. Jai Hind and bye. Have a good lunch. Thank you.
Thank you, ma'am.
Jai Hind. Shall we leave close?